The pelvic bones that make up the hip work in conjunction with the femur to enable movement of the lower limbs. Today we'll be focusing on the femur and the muscles which insert onto it. As the muscles insert on the femur, the actions are mostly at the hip joint, with some crossing the knee. Many of the structures on the femur are similar to those of the humerus, but with different names. The most proximal end is called the head of the femur, which articulates with the acetabulum. We then have a number of sites for muscle attachment. Laterally is the greater trochanter, and just inferiorly and medially we find the lesser trochanter. The linea aspera is a ridge of roughened surface on the posterior aspect of the femur, to which are attached muscles. The lateral ridge is very rough and runs almost vertically upward to the base of the greater trochanter. It is termed the gluteal tuberosity and gives attachment to part of the gluteus maximus. As we move down the femur, remaining on the posterior surface, there is almost a triangular-shaped area at the distal end called the popliteal surface. The popliteal artery and vein cross the knee here. At the most distal end, we have the medial and lateral condyles, with the medial and lateral epicondyles sitting just above them. On the anterior surface, at the distal end, is the patellar surface, where the patella would sit. There are a number of ligaments supporting the hip joint. For most of them, their name gives us clues as to their location. The ischiofemoral ligament goes from the ischium to the femur on the posterior surface. The iliofemoral goes from the ilium to the femur on the anterior surface. The pubofemoral goes from the pubic bone to the femur and is more medial than the iliofemoral. The inguinal ligament is a band running from the pubic bone to the anterior superior iliac spine. The inguinal ligament demarcates the abdominal region from the femoral region. The ligamentum teres is located within the hip joint. It goes from the head of the femur into the acetabulum, and it may add some stability to this joint.